Sige, ang na-assign sa atin is application project 2 about the laws governing the community pharmacy practice. So, sa presentation, bala yung 1, 2, 3, 4, 5, 6, 7, 8, 9. Ito nga, onta ni siya. Dalawa-dalawa, pero may isa nga tatlo. Tama ba? 2,
Sa
4,
part
6. Oo. Oo. Pero ano nga sa inyo nangadaan, how? Para ma-disseminate na lang.
wait.
Nadula ka?
Ako?
Ako?
Oo, wala ko may nabatian. Kagay na, how lang nabatian ko.
Sige. Balik ko ha. Kung ano na para ma-disseminate na lang daan. Kung amo na na dayon ng inyong imuan.
May answer
Din
na
sa
ko
mga
sa
part.
part 2.
Ano ka, be?
Di ba nang ano nino A to I?
Oo.
Oo.
Pila-pila tahaw.
Tututa, pero may sige isang
May isa nga
tatlo.
tatlo.
Aring AB na lang akon.
AB mo. Okay, next.
CD akon.
CD. Sunod.
EF. Tatlo na lang yung mo, Ben.
Awag sa dyan.
Ako na sa EF.
Tapos,
Sige Pero, ang ano lang nang i-compile lang, isa lang mag-compile. Para isa lang sa iyang,
amo tong
Diba
himuan.
copy-paste lang mo na kung ano ganun, verbo
Oo, Ben.
Oo, i-compile lang.
Tapos
na dahil bahala ano be?
Amo na to iPPT tatong gipang compile.
Oo. Amo tapos mapasa ta karon before 2 sa PPT.
Okay.
Amo na lang to, dito na to i-explain no. Mag-record hindi na.
Oo. Pero feeling ko kailangan ta mag-discuss bisan kamay lang para sa sa requirement 3 sa Zoom meeting nga kay nakabutang mandri nga kailangan mag-discuss sa mga answers sa topic na kin-assign sa imo. Diba?
So mamit na lang taliwat after himo PPT.
Subong na. Para diretso na lang.
Sige.
I-copy man di ba kamo sa inyong answers?
So mag-start na lang ko, Ben. Mag-start na ko yan?
Oo, be.
Sige. So for the laws governing the community pharmacy practice, the first law is the Philippine Pharmacy Act and the second one is the Foods, Drugs, Devices and Cosmetic Act. For the Philippine Pharmacy Act, it is an act also known as the Republic Act number 10918. So we are all familiar for this because it is the Philippine Pharmacy Act or the pharmacy law. It is signed on the date July 21, 2016 by the President Benigno S. Aquino III. For this law, it is an act regulating and modernizing the practices of pharmacy in the Philippines. This recognizes the vital role of pharmacists in the delivery of quality healthcare services through the provision of safe, effective, and quality pharmaceutical products, pharmaceutical care, drug information, patient medication, counseling, and health promotion. So this law recognizes us the future pharmacists or the pharmacists to have the most effective use of medications for the patients. It is for the essential provisions that regulates the operation of a pharmacy. The pharmacist provision services shall therefore be promoted as an indispensable component of total healthcare service to ensure the physical well-being of the Filipinos. So this really states that ang pinaka gid sang pharmacist is the healthy being of the Filipinos ang magiging purpose nila. And this in section 3 found the objectives of this law, which has the objective to for the standardization and regulation of pharmacy education. The second one is the administration of licensure exam. Tong sa PRC also found here anong mga himuon sang mga mag-exam, the supervision, control, and regulation of practice of pharmacy in the Philippines, and development and enhancement of our profession and the integration of the pharmacy profession. In section 4 is the scope of practice of pharmacy. Here are the preparation, compounding, and manufacturing of raw materials, the services provided, the engagement in teaching scientific, technical, or professional pharmacy, the dispensing of pharmaceutical products, and the administration of vaccines. Kay of course, ang mga pharmacies sila man gahimo vaccines that is approved by FDA. So, before administering, di ba, bago ni siya, dapat may ara sang ang pharmacist mag-undergo siya ng training for safe administration of adult vaccines and undertake scientific research and also to provide other services na ma-apply ang pharmaceutical knowledge. The next one is the Foods and Drugs, Devices and Cosmetic Act, which is also known as the Republic Act number 3720, and it is signed on June 22, 1963 by Corazon C. Aquino. This law is an act that ensures the safety and purity of foods, drugs, cosmetics that is made available to the public by the FDA, and the essential provisions that regulate the operation of pharmacy is found in First, Section 3 to establish standards and quality measures for food, drugs, and cosmetics, and also to adopt measures to ensure that the food, drugs, and cosmetics in the country are pure and safe. In Section 4, also found the other provisions which are to administer and supervise the implementation of this act, to provide for the collection of samples so that na ma-ensure yun ang safety nila, to analyze and inspect food, to establish analytical data to serve as basis for preparation of food, to issue certificate of compliance para ma-sure nga before ka mag-release ang food, drugs, or cosmetics, there are compliance and technical requirements that you should follow, to levy, assess, and collect fees for inspection, and to certify the batches of antibiotic preparations. In Section 5 are the Inspection and Licensing Division, which shall have a charge of inspection of food, drugs, and cosmetic establishment to make sure that the establishment nga ginahimuan sang drugs, food, and cosmetics are of quality and are pure. And lastly is the Laboratory Division, which shall conduct all the tests, analysis, and trials of products covered by this act.
Consumers Act. It is also known as Republic Act number 7394, signed on April 13, 1992 by Corazon C. Aquino. This act this act helps the state to protect the interest of the consumer, promote his general welfare, and to establish standards of conduct for business and industry. It protects customers against health and safety risks, protect to facilitate sound preference and the appropriate exercise of consumer rights, provide adequate remedies, and involve consumer members in the development of social and economic policies. Sa essential provisions that regulate the operation of a pharmacy, gisali dito ang Article 2, ang Declaration of Basic Policy, Article Article 5, Article 6, Implementing Agencies, Article 8, Publication of Consumer Product Standards, Article 10, Injurious, Dangerous, and Unsafe Products, Article 18, Prohibited Acts, and Article 19, Penalties. Sa third, the Food Drug Administration RA Act or 11, or also known as the Food Drug This act is an act strengthening and rationalizing the regulatory capacity of the Bureau of Food and Drugs in appropriate testing laboratories and field offices, improving its equipment, augmenting its human resource complement to retain its income, renaming it the Food and Drug Administration or the FDA, amending certain sections of Republic Act Number 3720 as amended, and allocation of its fund. Essential provisions that regulate the operation of a pharmacy. Section 3. It is hereby declared a policy of the state to adopt, establish, institutionalize, improve, and maintain structures, processes, mechanisms, and initiatives that are aimed to A. Protect the right to health of the Filipino people, and B. Help establish and maintain an effective health products system and undertake appropriate health manpower development and research responsive to the country's health needs and problems.
So next is tong sa Generics Act. Generics Act is also known as the Generic Act of 1988 or the Republic noong September 13, 1988. So sa brief discussion yan, ning act nga ni nag-promote, nag-require, and nag-ensure siya sa production of an adequate supply, sound distribution, and use and acceptance of drug and medicines identified by their generic name. So, ang iyang essential provisions that regulate the operations of a pharmacy is siya makita siya sa Section 7, Section 8 hangtod sa Section 11. So, sa Section 7 is the provision on quality, manufacturer's identity, and responsibility. Sa Section 9, dira tong rules and regulations. Sa Section 10, authority to import. And lastly, sa Section 11 is the education drive. Next is the special law on counterfeit drugs. So, ang name sa law is Special Law on Counterfeit Drugs or the Republic Act number 8203. So, ginsign siya ni Fidel V. Ramos last September 4, 1996. So, this act is prohibiting the counterfeit drugs and providing penalties for violations and appropriating funds. So, sa essential provisions that regulate the operation of a pharmacy, under siya sa section 4 sang sa prohibited act. So damo siya siyang sa baba pa nga mga declared unlawful and nga act. So makita ang mga manufacturer, sale, offering for sale, donation, distribution, trafficking, brokering, exportation, or importation, or possession of counterfeit drugs, and then meron man silang possession of any such counterfeit drugs, and then forging, counterfeiting, selling, falsely representing, or without proper authority using any mark, stamp, tag, label, or other identification mark or device authorized or required by the Republic Act number 3720. Then may man tong photocopying, duplicating, alterating, printing, transferring, and lastly tong making, selling, or concealing any sponge, dye, plate, or any other equipment or instrument designed to print, imprint, or reproduce the trademark, trade name, or other identifying marks of other registered producer or any likeness thereof upon any drug, product, or device or its container or label without authority from the legitimate owners of the trademark or the trade name.
So my report is about the Comprehensive Dangerous Drug Act of 2002. Ang RA RA number 9165. It is signed on June 7, 2002, and ang president niya kay si Gloria Macapagal Arroyo. For the brief description naman, syempre it's all about years drug kung paano ang ilang proceedings, funds sa ano. And then sa section naman nga nag-regulate siya under section 17, under section 21 of custody and disposition of confiscated, seized or surrendered dangerous drugs, plant sources of dangerous drugs, controlled precursors and essential chemicals, instruments, paraphernalia, and or laboratory equipments. Next is the expanded Senior Citizen Act, which is Republic Act 1994. And ang date nga na-sign siya is February 15, 2010. Same President, Gloria Macapagal Arroyo. And of course, expanded Senior Citizen Act nag-focus sa mga senior citizens. It is an act of benefits and privileges to senior citizens. Further amending Republic Act number 7432 as amended, otherwise known as an act to maximize the contribution of senior citizen building, grant benefits and special privileges and for other purposes. Sa regulation niya naman is section number 5, and then section number 6, section number 9, which talks about the implementation of rules and regulations. So, dire nakabutang itong mga within 60 days niya from the effectivity. Tapos itong mga discounts nila muna sa Act, Republic number 7581. Na-sign siya noong May 27, 1992, and the president was Corazon C. Aquino. So, for the description, it is an act providing protection to consumers by stabilizing the prices of basic necessities and prime commodity measures against undue price increases during emergency situations